My name is Leslie Hayes. I run the Hayes Approach, which is an outsourced fractional HR company. We provide HR services to just about 50 small businesses throughout the United States and a couple in Spain and one in Iceland. I'm not sure how Iceland happened, but it's kind of exciting. I have had a wonderful career, and I had the opportunity to study organizational development and organizational leadership at Harvard and at Eastern University in the international program at Eastern, which was very fascinating. It was people from all over the world coming in, and we lived together for a month, 2 years in a row, and then spent time virtually before COVID. I also started my career as a child abuse investigator and social worker before moving into human resources. And so that's the perspective that I bring to the concept of bias. I have a wonderful panel here today. If you will get comfortable, I'm going to tell you a little bit about them. I did not even try, well, that's not true. I tried for about 3.5 seconds to memorize their bios, but it is too much. So get comfortable, and we're first going to learn about Vida Jennings. I knew I was going to get that wrong. Vida is currently employed with BlueCross BlueShield of South Carolina. She's been with the company since August of 2002, and in the Human Resources Division since August of 2005. In her role as Director of Employee Relations, Diversity and Inclusion, she oversees employee relations operations, diversity initiatives, equal opportunity, and affirmative action compliance. Vida also serves as an adjunct professor for the Southern New Hampshire University School of Business. Vida currently serves on the board of directors for the Free Medical Clinic of Columbia and the Girl Scouts of South Carolina Mountains to the Midlands. She has received a number of awards and recognition for her leadership service with Toastmasters International. Vida is a Leadership Columbia graduate and was recognized as a 20 under 40 by the State Media Group in 2012. So this is Miss Vida Jennings. Next to her, we have Juana Slade with AnMed. And Juana is the Chief Diversity Officer and Director of Diversity and Language Services, which is fascinating to me. I have a friend who runs an interpretations and translations business, so it's interesting to see that piece. Juana Slade is Chief Diversity Officer and Director of Language Services with AnMed, one of the first acute care health systems in South Carolina to dedicate full-time resources to strategic diversity management. Under her leadership, AnMed has developed an integrated diversity, inclusion, and health equity framework to support the organization's increasingly diverse patient population and workforce. This work has been recognized by numerous organizations, and I mean numerous. This is just a sample of them. I had to cut several out, including the U.S. Department of Health and Human Services, Office for Civil Rights, the South Carolina Hospital Association, the South Carolina Chamber of Commerce, the American Hospital Association's Institute for Diversity and Health Equity, and many, many others. Earlier this year, Juana was named a trailblazer by the Institute for Diversity and Health Equity for her impact and contributions to the healthcare industry. Juana serves on numerous boards and community service agencies and is a member of the Board of Trustees of the South Carolina Hospital Association. She's also the immediate past chair of the Alliance for a Healthier South Carolina. Excuse me. Notably, she's a founding member of the Anderson Area Remembrance and Reconciliation Initiative, a community effort established in 2020 to raise awareness and inspire action to eliminate disparities and propel Anderson County toward the goal of a beloved community. Ms. Juana Slade. And bringing us home, and no slouch himself, we have Dr. Tierney Bates. He has established himself as a national thought leader, speaker, networker, career coach, innovator, and voice on diversity, equity, and inclusion, and Generation Now. He has given over 214 keynote talks, presentations, and workshops. If you would like to make it an even 215, he would probably appreciate that. With over 20 plus years in higher education, he's currently the Vice Chancellor for Student Affairs at USC Upstate. I don't think that's going to get you a better grade. As an aspiring college president, he's known for his leadership, vision, and strategic initiatives and solutions with an emphasis in student success, diversity and inclusion, career and workforce development. He has over 15 regional and national awards, including one of the highest in his profession in the 2023 Diamond Honoree and first National Max Leadership Awardee in 2021 by the National Association of Colleges and Employers. Dr. Bates is from Cleveland, Ohio, received his Bachelor of Arts in Mass Media Communication with a minor in African American history from the University of Akron, his Master of Arts in Higher Education Administration from the University of Akron, and his MBA from Bryan College. He also has a doctorate degree from Spalding University and has served on 5 nonprofit boards, including the Urban League, United Way, and is a member of the organization of Phi Beta Sigma Fraternity, 100 Black Men, National Black MBA Association, National Association of Colleges and Employers, and Prince Hall Mason. Dr. Tierney. After those illustrious introductions, I'm gonna need a little tiny break. I'll be back. So we are gonna talk about implicit bias. Implicit bias, I want to set the stage for just a minute, and then you're not going to hear very much from me. Those of you who know me will laugh at that because I'm a big talker, but that is indeed the plan. Implicit bias can be difficult to talk about, and one of the things that I would love to create in this space for the next few minutes is a safe place to think and to ask questions and to recognize that every single one of us has implicit bias. I started studying this work back a long time ago in college. I took a graduate course during my undergrad with a world-renowned professor of language and the psychology of language. And you're saying, why in the heck are we talking about that? I learned that much of the mechanism that causes us to have implicit bias comes from the way that our brains are wired to acquire language and to make sense of the vast amount of information that we have out here in the world, right? We are wired to categorize. We're wired to categorize quickly. Think about when has anybody in here ever seen, been held, talk to a baby? Anybody? So when you first are teaching little people things, you hold something up and you say, ball, right? And then what do? Everything that is round, it's an orange, it's an apple, it's a watermelon, clearly I must be hungry, but it's a ball. Well, there's a reason for that, because our brains are wired to categorize, right? When I say dog, what do you think of? Spit it out. Barking. What else? Anybody have the words man's best friend run through their brain? Your best friend? How about when you think of a cat? Right? Kind of standoffish, difficult, right? How about the phrase, leaflets 3, let them be? Anybody heard that phrase? Poison ivy, poison sumac. Did you know that there's an awful lot of 3-leafed plants that are not poisonous at all? And they're wonderful plants. Virginia creeper is one of them. Box elder is one of them, right? But we develop these quick judgments in our brains, and they're adaptive. They don't make us bad people. They make us human people. However, they can get in the way because sometimes we don't stop to think, is that really knowledgeable? Is that really accurate? Or is that just one of those things where leaflets 3, let them be, get that out of my yard, when in fact it's a really beneficial plant and it keeps mosquitoes at bay? So part of what we want to try to talk about today is what is this thing called implicit bias? How common is it? And what can we do about it? Because clearly, we're not going to eradicate it. How many people here are breathing today? Anybody breathing? Breathing, okay. If you're breathing, you have implicit bias. If you're breathing, it exists. And it doesn't have anything to do, the fact that you have it doesn't have anything to do with your background or the groups from which you have been raised. What your implicit bias is has a lot to do with experiences that you may or may not have had. So when we talk about implicit bias, I want everybody to kind of take their little walls down, take your fear and put it in your pocket for a minute, and let's just talk about this thing that is real, that helps us learn language and make sense of this crazy world and figure out that, oh, that's a bear walking over there. Perhaps I should not pet it, right? It's not a dog. I can tell the difference. A small child, by the way, cannot tell the difference between a bear and a dog, so keep an eye on them if a bear wanders down your street. This happens in Asheville. But how is it getting in our way? And then what can we do about it? What can we actually do about it? Is that fair? Is that a fair ask? So we do have some things to talk about, and we have some wonderful things for my illustrious colleagues to tell you and to share. But we are going to leave some time at the end for questions, and I would also encourage you, if you've got a burning question, go ahead and raise your hand, and I will try to call on you. I will tell you, I'm sorry, please, you have to be quiet now if you're getting us too far off track, because we have some things we do want to cover. But we want to involve everyone. All right, so first, as we go around, would each of you just share a couple of examples of implicit bias that you have encountered in your life?
Okay, I'll pick two. The first, with a name like Vida and not having a very pronounced Southern accent, and having graduated from Wake Forest University, go Deeks, I remember showing up for a job interview and the person saying, "You're not exactly what I expected." So that's an employment example. Another example, over the course of my career, I've had the opportunity to go to a lot of wonderful conferences, much like this today. Several years ago, I was at the Chief Learning Officer Symposium, the CLO event at Hotel Del Coronado in California. And prior to going to a reception, I decided to take a stroll upon the beach with one of my peers. So coming up from the beach, we go to enter the reception. My coworker walks through, no issue. I go to enter the reception, and I was stopped and said, "This is an invited guest event only." Now, not wanting to fall into the stereotype of the angry Black woman, I had to take a moment to compose myself. And while I was thinking of the right words to say, because I'd been a diversity practitioner for quite some time at this point, to be able to educate and inform in the conversation, an ally stepped forward before I had the opportunity to voice my own opinion, and came up, and not even the person I was walking with, though. That was funny, because she was going through the buffet. She wasn't even thinking about me. But someone else was at a table. He was a senior development officer in our information systems area, saw me, got up from the table, walked over and said, "Oh, we've been waiting for you and we have a seat for you. Come right over here." Of course, eventually before the night was over, the sponsors, the magazine sponsors for the event had apologized. The hotel had apologized. Everybody had apologized. It became like it was one of those moments where, everybody went silent because everybody heard the person stop me at the door. But then you say, what can you take away from that moment? And then how can you work to move forward and not be upset? So those are my two examples that I wanted to share, both in employee-focused environments.
Hello. Well, my two examples are personal as well. First, my name is Juana. I'm somewhere in the neighborhood of 60 years old. I quite often get mail addressed to Juana Slade, of course. I quite often get phone calls in Spanish. The assumption is that Juana is a Latina. And so I started using my she, her pronouns on my greeting card. My signature card, rather, so that people would understand and know who I was prior to that statement. And I've had several people at work to ask me, why am I using my pronouns? Because everybody knows who I am. I use my pronouns for guests who may be reaching out to me who don't know who I am, so that they're not going to make assumptions about me. Second example, similar to Vida. This was early in my career. It was maybe 2001 or 2. It was the first time I'd been invited to speak at a national conference, and my husband was a line tech with a local power company here in the Upstate, and he took off from work to go with me. We were staying at the Copley in downtown Boston. Here I am, sensory overload. I'm just so excited. Had a chance to go down the first day that I was there, go down to the basement, and I saw the beautiful indoor swimming pool and the spa, and I was so excited. And Calvin and I had gone shopping to get him something brand new to wear to hear me speak for the very first time on a national stage. We are really excited. We ate seafood from the time we got there, and we were planning what our meal was going to be after my first presentation. But I wanted him to see this swimming pool. So we go downstairs. The door right adjacent to the elevator bay was the door to the spa. This very well-dressed white woman came out of the spa. Calvin, by the way, did I tell you he's about 220 pounds. That's on a good day, more like 250 on the real day. But right at 230 pounds, 6'1", ex-football player, big guy. This lady looks at him. Oh, by the way, did I tell you he had on his new outfit? Looks at him, head up, toe down, looks at me. By the way, did I tell you I had my very first briefcase for my very first conference? She looked at both of us. The elevators, by the way, did I say that the elevators were glass in the Copley? She looked at us, stepped back. Calvin, who was an ultimate gentleman, extended his hand to allow her in. She grabbed her purse and stepped back. I was so enraged that I didn't know if I was going to be able to do this. We went up to the first floor because I knew that the mezzanine, after we left the mezzanine floor, you'd be able to see. I wanted to see if this lady was going up. I said basement, so she couldn't have been going down. I wanted to give her a pass to see if she got off at the mezzanine floor. She didn't. She got off at the first floor. Why did that lady do that? We looked like we should have been there. We acted like we should have been there, but there was something implicit about her thoughts regarding us that said, step back, don't get on.
How do you follow that? First of all, my first name is Tierney, so if we're gonna go with the names in that regard, I always get the phone calls, can I speak to Mrs. Tierney Bates? And I said, you're talking to him. A lot of times, right, in that regard. So my first name, I'm the only male Tierney I know. If you pay attention, Tierney means one of nobility. in Gaelic and Irish, right? And so in that regards, I always get mistaken for a female. I never forget I walked into a job interview one time, and they actually had a bet that they didn't know if I was a male or female based upon my first name. So I walked in, and the guy said, yes. I didn't know what was going on at the time. Go through the interview. When I got the job, he tells me later on, like, we had a bet. And I won because I said you were a male, and they were like, no, it's a female, as far as that's concerned. So a lot of times with my first name alone is one of those implicit bias things that happen overall. Another incident that happened to me, growing up in Cleveland, Ohio, of course, and you think that northern states, Midwestern states are a little more progressive sometimes than the South, they're not, is got pulled over by the police. In that regard, and I was probably 18 at the time, and it was my friend Yalak, who's from Ethiopia, and my other best friend Akil. When a police officer asked us for our IDs, we gave it to him, and I just was curious why you pulled us over, and he was like, I saw you guys run to the car. Well, I don't know if you guys remember when you were younger, you used to run and say, shotgun, right? So that's what they were doing, and I was running behind them because they were fighting to get, I was driving, they were fighting to get in the front seat. But the comment he made afterwards when he got our IDs, because I knew my rights because all my dad's best friends are cops, I said, oh, that's interesting. And then he said to me, you guys all need to get new names. And I said, wow, what's your badge number again? Because you about to get reported. You don't know who I know as far as that's concerned. So that's a prime example of some things that implicit bias that have happened to me. I think one thing that when we talk about implicit bias that I would just want to highlight, if you don't mind, Leslie, is when we talk about fit. How many people in here work in HR? Do recruitment, everything like that? Stop using the word fit. It is rooted in classism, sexism, racism, Western European idea-centric ideas. Example, to all my sisters in the room, I know this personally. When you go to a job interview, most of the time you have to what? Straighten your hair. So when we think about fit in corporate America, somebody said, not anymore, right? But there's only 7 states that have passed the Crown Act, right? I don't even know if South Carolina's on that list, right? But we always know, people like, no. So that's a prime example. So when we talk about fit, how are you letting people show up as their authentic selves in the interview process, particularly people of color? I used to have my hair longer. I had a beard, the whole nine. I was trying to look like John Legend. That's all I like to say in that regard. But again, if I have to walk into a job, I have to go cut my hair, shave, all this other great stuff, and I can't be my authentic self. So that fit terminology, I've actually written an article on that, needs to be tossed out. And that's something because a lot of our people that work in HR and recruitment, they're always saying we're looking for a right fit. And to me, that is one of those things that go to my mindset of you're not looking for me then.
Have any of you been thinking about any examples that you know of that have happened? I'd like to share one that is a little bit different that has happened to me. When I said I was a child abuse investigator early on, I was in my early 20s, young, white, blonde, not any gray then, up in Pennsylvania. It was freezing cold, and I was going to a home where there was neglect. And one of my jobs was to stop and get some diapers and some formula for this family. And so I was in the grocery store. I don't know if anybody's ever been to Pennsylvania in the winter. It is really cold and really snowy, and you don't bother to fix your hair, and you don't bother to put on makeup. You just try to stay warm. So I was in the grocery store, and I had my stuff, and there were a couple of other things that I had to pick up for them, and the woman at the register started sorting my things. And then I stood there, and she said, she had her hand out, and I handed her, we had a per diem. This was back in the days of cash. And so I had a cash envelope, and I had to give the cash and then get the receipt and take it, turn it back in, all that good stuff. And I handed her the cash, and she said, oh, no, you can use your WIC for this. And I said, well, I don't have that. I don't have that. I'm just going to pay you. And we got into a little bitty argument because I certainly wasn't going to tell her that I was a social worker headed to a family. I said, I need these things, and I have this cash, and I'd really appreciate it if you'd tell me. So again, implicit bias. She was white. I was white. No racial issue there. But because I was a young female buying baby things with no wedding ring and I looked probably kind of bedraggled, she assumed that I needed WIC. So this implicit bias, it happens everywhere all the time. It's extremely prevalent. And one of the things that I wanted to share is that we were going to show this little video that I know some of you have seen. I decided not to try to tempt the gods of technology, but it's a video that likens, be careful you get the clean one, because there's a not clean one out there too. But it's about a 2-minute video that likens little bitty bias actions to mosquito bites, right? That little bitty thing happened to me. Okay, clearly it made an impression on me because I still remember it clearly 30 years later. But it hasn't happened to me as often, right? I've not had as many of these kinds of experiences. Some people get more of them. And depending on where you are and who is around you, you may experience more of them. One mosquito bite, a lot of people say, God, why do people get so bent out of shape? Just roll with it. People don't mean anything by it. Why are you so upset? Well, if your body is covered in mosquito bites every day, day after day, it gets a little annoying. It's kind of painful, and you might lose your ability to be a grown-up every now and then, right? So as we're thinking about this, and our immediate self, right, goes to say, well, I just don't think I'd handle things that way. I'm not sure this is such a big deal, or maybe it's more, DEI has a whole, this is a race issue. Well, DEI, I hate to tell you this, is not just about race. It's not just about ethnicity. It's not just about disabilities. It's not just about gender. It's about the fact that I really, really like mayonnaise sandwiches, and some of you people don't. We all are very, and that is wrong, by the way. We all are.
Don't watch Undercover Brother then.
We are different. We are different human beings, and we judge each other. We are exceptionally good at it. And so when you think about the prevalence, it's happening every day. It's probably happened 17 times in this room to every single one of you so far. Okay? So let's talk a little bit about the impact of that bias. So if you're somebody in a situation where that mosquito is biting you over and over and over again, what impact does that have on the people and people around them? And Juana's going to speak to us about that.
So let me take the temperature of the room. How many people work in healthcare or a hospital system? Raise your hand. Okay, good number, half of the room. So you all will be able to identify with this. I've got several colleagues in the room, and I don't want to call them out, but these are the allies for the work that we do in diversity and inclusion, and certainly language services at AnMed. There's a gentleman on the front row, Jonathan Rios, is the manager of language services. Jonathan himself is bilingual, but he is responsible for our successful language service provided last year to about 22,000 individuals, 22,000 times, and we got it right most of the time. That's a whole nother conversation around auditing and monitoring. There are two other people in the back of the room, Suzanne Wilson and Nedra Brown. I took just enough science and math to graduate, that's all. But I get up and go to work every day and take care of sick people because I work with people who help keep me legitimate. In our industry, what gets measured and monitored matters. So if we can't measure it, if we can't monitor it, if we can't figure out a way to quantify what it is, it's not really that important. I, as a diversity officer, can't do all of that alone. So I've got to have people to help me with this. One of the things that we have found out over the last few years, we are a hospital system in Anderson, South Carolina. Our North Campus is this beautiful, sprawling, it looks like a mausoleum rising up off of the side of the road headed into Anderson. We've got our beautiful logo on the side of the building. Everybody loves to be out there. We have a gorgeous walking track. We have, we're going to plant a community garden on one of the areas. It's 125 gorgeous acres. The average age in that neighborhood is 82 years. We've got a wonderful Walmart market, not the regular Walmart, that's on the other side of town. We got the market across the street. We have Ingles down the street. We have all sorts of restaurants. 2.5 miles north of our emergency department. Now, 2.5 miles south of our emergency department, that average life expectancy is 67 years. No sidewalks. We don't have a market. We don't have a restaurant. There's certainly, well, I take that back. AnMed is responsible for a couple of community gardens in that neighborhood. We have to take responsibility not only for those people who are living to be on the average of 82 years, but 67 years as well. So when it comes to the implications, what it actually means if we bring bias into the healthcare environment, the numbers are not going to improve in the place that need it the most. We have Suzanne Wilson, one of the individuals who was very instrumental in helping us to operationalize our ability to measure and monitor language services. She is responsible for population health. Fascinating thing that she's done to try to address that population that's 67 years, and that's a transition clinic. She's responsible for finding ways to connect those people who come to us over and over and over again, using our emergency room for emergency care, for regular health care. She's helping to figure out what we need to do in those key communities to make sure that people are not coming to the wrong places for care. When you also ask the other issue, I think that's really important, when you ask why that matters, it matters so that we are able to make a difference every encounter, every person, every time. Every team member has to have the opportunity to bring their whole self to work, because we all get up and go to take care of patients no matter what our specific jobs and responsibilities are. We have one product and one product only, and that's patient care.
Follow up. Y'all give her a round of applause for that. Because she's talking about healthcare, and healthcare is near and dear to me in some regards because of what you were just talking about, especially for communities of color in that regard. And growing up in Cleveland, Ohio, where the world's hospital is, Cleveland Clinic in some regards, just around the Cleveland Clinic is the same way. You go to neighborhoods that literally were strong black communities, but they couldn't get their service. So an example of that would be that you guys know there were at one point in time in history 11 black medical schools, right? There were 11 black medical schools at one point in time. A doctor from the University of Louisville, based upon implicit bias, said there shouldn't be 11 black medical schools. And now there's only how many today? 4. See? 4. Go ahead. Meharry, Morehouse, Charles Drew, and Howard. That's the only 4 that exist. Morgan State's coming next. Shout out to them. So it's important to understand when we talk about diversity, equity, inclusion, and belonging in some regards, we got to look at the historical context as well. And a lot of that still plays out in today's metrics around healthcare, our hiring practices, and even in education, my field, in that regard. I heard Dr. Williams talk about it earlier about quality. And then some of the things we're talking about with the Supreme Court's decisions overall. Well, at USC Upstate, we're the most diverse school in the state of South Carolina, right? 48% of our students are students of color, 68% women. And so when we talk about it, we just walk the walk. We don't have to brag about it. We don't have to do certain things in that regard. We're just there. We're led by a man that looks like me, who I'm honored to serve and work with as far as that's concerned. So when we talk about certain things, we always got to have that historical context as well to make sure we don't make those same mistakes around implicit and unconscious bias, and also own our own implicit and unconscious bias, because as Leslie said, we all have it. I say it because I'm an able-bodied male. And as an able-bodied male, even though I'm a black male, I can still go and do certain things that some women can't do, able-bodied people can't be able to do, all that other stuff. And when we talk about diversity, equity, and inclusion as a summit, one of the things that we miss out on from an inclusion lens is usually accessibility and disability. That is one of the ones that's always left out because we usually focus on race, sexual orientation, ethnicity, and some of the other things as far as that is concerned. But we're not doing anything when we're talking about neurodiversity. I don't know if you guys are hip to that and what's going on in the workplace around that. And all the other factors that are coming out around accessibility and disability, particularly when more of our kids today are on meds. And that's an issue in itself in some regard that we're not even having a discussion about, because that's going to impact us, particularly when we talk about Gen Z, who in the next 10 years will make almost 40% of the workforce. Start talking about millennials, they're in their 40s. Start talking about Gen Z, those born 1998 to 2015 will be your workforce in the next 10 to 15 years, and they coming for you.
Okay, that is correct.
I know we're running short on time. I just want to mention, piggyback off of Tierney's comment, that October is National Disability Employment Awareness Month. And if you're not observing this in your organization, it is definitely a time to increase access to individuals with disability. I'm proud to work for an employer that has more than 800 individuals with disabilities. And we really focus on that in our organization. And our president of our private business division just recently had a conversation around disability in the workplace and sensitivity. And we really think that that's another crucial conversation that people have, because it's not what people can't do, it's what they can. And you want to value that. Everybody brings talent to the workplace. So if you're saying you have 1,000 jobs or 500 jobs, you may be missing out on untapped talent because of your biases against people with disabilities, much like other biases that we're here to talk about today. So look at it as a future talent pool. Everybody wins.
That is an excellent transition, because one of the things we want to talk about is, so why do we care, right? So we all have implicit bias. We've had implicit bias for however long there have been people. We've somehow managed to rub along more or less well without completely blowing ourselves off the map, at least not yet. So why does this even matter? Why are we here today to deal with it? As an HR person, I can give you my perspective, which is, number one, there aren't enough people to do work. There just physically aren't enough human beings alive who are capable of doing work. Number two, the jobs keep changing, right? We're gonna have to change the jobs for AI, we gotta change the jobs for technology, we gotta change the jobs for environmental impact, we've gotta change all kinds of jobs. Well, as long as we're changing jobs, might as well look at what the people who actually can work and are alive and want to come can do, regardless of whatever their background, identifiers, categories, etc. So it's a way to start getting organizations to open up their minds and say, is there a different way we could do this kind of work that would keep us from smacking our heads against the wall because we don't have enough people to do it, and get us better results? I'd like to open it up to this group and say, where do you see the biggest impacts on your organization in terms of improved diversity, equity, and inclusion with regard to implicit bias?
In April of this year, those of you who are in healthcare, you will understand what I mean. In April of last year, rather, we were given a gift. The Centers for Medicare and Medicaid said that social determinants and health equity had to be a part of our strategic plan. The Centers for Medicare and Medicaid Services said that we have to be able to, 2 years from now, demonstrate our ability to collect information around the social determinants, what they were. I don't want to try to remember the 5 factors. I know Suzanne could tell us what they are, but I think it's food insecurity, transportation, safe housing, that's right, and there are 2 others I don't remember, but there are 5 of them. So
Access to chocolate?
So, and not only that, in 3 years, we're going to have to be able to show what we've done when we found those insecurities. So just finding out that somebody doesn't have transportation to get to their appointments, that somebody doesn't have a safe place to live, that somebody doesn't have the food to eat isn't just enough for us to check the box and say, yes, we know. We now will have to have partnerships in the community that allow us to document what we've been able to do to help these people once we find these issues. That was a diversity, health equity, and inclusion gift. Because now, the very first thing that we have to do at the end of, January 1 of 2024, it has to be in the strategic plan that has been authorized by our governing groups. So now it's not the diversity, equity, and inclusion employee resource groups. It's not the diversity officer. It's not people in human resources. Now it's a part of our operating plan. So when I say the game changer for us was that the government finally has said, you don't have to do what you're doing because it's the right thing to do. Now we know it's required. So now I just get to help exercise the requirements.
Well, how many people I got in here in education? Raise your hand if you're working in K through 12 or higher education. Really, the demographics is going to tell us what's going to happen for us. Birth rates are low in certain communities and populations overall, so black and brown will be the future of this country. So if we think about it right now, the fastest growing population is our Latino community, right? Many people need to be educated on the Latino community, right? That consists of 23 countries, and they don't all speak Spanish the same. And they're not all from Mexico. So as we get ready to prepare for K through 12 and we get prepared in higher education, we need to look at how we're supporting these groups coming into our space, because they're coming no matter what. So we need to be prepared, we need to be ready. We need to hire people that look like us in these spaces. We need to train colleagues that don't look like us in these spaces, because if you look at K through 12, what does most of the time the teacher look like? A white female, right? That's why I send my daughter to an all-black school in some regards, where all the teachers are black, because I want her to be raised in that environment as far as that is concerned. It's important to me, and I know she's going to be coming out into the real world, as we like to say, but that's important to me too from a foundational perspective overall. So we have to get ready in K through 12 and higher education. We have to train, constantly adapt, move forward. Prime example, I know my VC for marketing and communications in the room, when I got to USC Upstate, I said we need stuff bilingual. I'm not waiting around for Columbia or Beaufort and all these other campuses. We're going to be the first to make sure stuff is bilingual, whether it's marketing tools, whether it's recruitment, whether it's even language on our walls when you walk in. Y'all do it in healthcare. So it's important for me to make sure that, so when I have a family that's coming from Texas, when we recruit for soccer, they walk in, they're like, oh, this place woke. They got something going on as far as that's concerned. And so it's important for us to understand that. So in education, we're going to have to shift no matter what because of the demographics. We have to be there, but we also need more bold leadership, innovative leadership. And I like to call myself the Steve Jobs of higher education, because that's what it's going to take to be able to change the narrative around a lot of this.
So that question gave me a moment to pause and think and reflect. We do really well in the healthcare space, social determinants of health. We're looking at those, health innovate, we talk numbers. And because we're a health insurer, we're working in our communities to make our communities a better place for where we serve our customers. But then we also have individuals that can't afford our insurance, and that's why through our foundation we fund the free medical clinics across the state of South Carolina. We want every South Carolinian to be a healthy person. But when I look at what diversity, equity, inclusion needs to happen for us internally, I had to pause. We're in a unique organization. 75% of our organization is female, which you would be surprised to think about that in an insurance environment. I think we have great racial diversity. You heard me mention we have a number of individuals with disabilities. We have a high veteran population. What is it that's next for us? And Tierney, I think you're spot on. It's the future. We have a lot of employees, like I've been there 21 years. It's not uncommon to hear someone say they've been with our organization 20, 30, 40 years. We have to prepare for next generation talent, and so we're focusing on those early career programs. We're expanding our internships. We're starting to talk to more colleges and universities. We can get people in the door, but what are we doing to keep them once they're here? Because there's nothing like coming into a party and not being asked to dance and not feeling welcome, and then you leave. And so that's what we need to do a better job as far as diversity, equity, inclusion, is making sure people have that commitment, that belonging, and that attachment to the organization. Social philanthropy, doing good in the community, that's what we're known for. That's what our employees are proud of. But we've got to build better connections with individuals, because we can get them in the door. It's just, can we keep them in our organization?
I absolutely love that metaphor. So is anybody out here interested in what your own implicit biases might be? You don't have to raise your hand, but we will judge you if you don't. I'm just saying, I will. So there is a test that is put out by Harvard. It's coordinated by Harvard. It's been going on for a long time. And it's called, I call it the Hidden Biases Test, but that's not its real name, so if you Google that, you're not going to find it. It's called the Implicit Association Test. And they have a lot. I don't know how many, 20, 30 various assessments that you can take. Be prepared. They are A, slightly annoying to take, and B, very revealing, because they will show it. Some of them will, you're not going to necessarily have implicit bias in every one. I initially thought, well, gosh, are they all going to show that? It turns out I'm not biased about certain things, but I do have biases in other things. And so then the question, right, maybe I'm not the mosquito, right? Maybe I'm not biting anybody on a regular basis. But am I asking people to dance? And if I'm not asking them to dance, why? Right? I don't have to ask everyone to dance. It's okay to not ask everyone to dance. But why? Why? And is the reason I'm not doing it fear-based? Is it bias-based? Is it because people who don't like mayonnaise sandwiches really are bad people and I shouldn't ever ask them to dance? I mean, there are some valid things out there. So the question I have for the panel is, how do we work with our own implicit biases to try to overcome them? Thank you.
So very quickly, I'll just say some ways to overcome bias is self-reflection. Surround yourself with people who will call you on your BS, right? You need to have people who will check you, and you need to be the person to check other people. Be proactive around educating yourself, and always spend time with people from different backgrounds than yourself. Expose yourself to things different. We all have some type of bias. I have a bias against short people. When it comes to dating, I'm just saying, see, let me clarify. But I'm owning up to my bias, right? And I'm trying to do better and not just trying to automatically shut people down if they're not 5'11". But you need to at least consider and be open to other things. I've taken some of the Harvard implicit bias things. I had no signs on age for prevalence for either older or younger. But when it came to gender roles and traditional roles, the southern side of me just poked on out. And I associated females more with family and men more with career. But it was something to say, aha, let me think about that a little bit more. So, again, surround yourself with people who can call you, like Tierney, who says, look, you're missing out. You need to expand your horizons. That's why you're single at 50, right? I think she's ready for you to open it up for questions because she's giving us some.
She's giving us the eye. All right, what questions do we have from the group?
Thank you all for sharing. It raised a question for me to ask about what resources are available around advocacy in healthcare. For example, my father was hospitalized. He's diabetic, had part of his foot cut out. I was there for the discharge. I asked questions. What does he need to do later? Blah, blah, blah. Well, a week later, he called me. He's like, nobody's been here to replace his bandages, which could have rehospitalized him. It took several hours of calling the hospital, the information on the paperwork, all these things. And finally, I was told, oh, a mistake was made. We should have put this information on there instead. And then 3 days later, a nurse showed up. So luckily, I advocate for my parents. But I have peers that are always saying, like, I don't know what to ask, or I always can't go to the hospital or the doctor with my elderly parents or relatives or whatever. So what resources are available around advocacy, because I'm not getting taken care of?
So let me just say, I can't speak for the organization where your father was taken care of, but I can tell you this. I say that AnMed is utopia. In my opinion, we truly focus on quality and safety. There are daily opportunities to look for situations like your father's. There's a whole team of individuals. Department was established just last year to focus solely on quality and safety. So there is an in-depth investigation that would allow us to catch something like that to address it. There are typically in hospital systems, there is usually a department called patient advocates, and they're usually divided and assigned based on units and disciplines and departments across the system. And so there will be an advocate who is well aware of all of the kinds of things that your father experienced in his situation. Last thing, and then I'm going to pass the mic. I was just sharing at lunch that I had an opportunity to participate in a family meeting. I wrote this down because I was hoping the time would allow me to get to it. This family meeting happened last Friday. This was an African-American gentleman. He was on a ventilator. He was in our critical care area. It wasn't a good thing to keep him on the ventilator, but it wasn't a good thing to take him off. And everybody in the care team agreed what needed to happen, what the solution needed to be for this gentleman, and of course it wasn't going to be a good thing. Everybody that was going to be in that room having that conversation was white. That was not, and so thankfully, the director, the leader of our ethics team, thought to pick up the phone and call the diversity officer and say, here's where we are, can we help? And I said to him, here's what you need to do. If you all have decided that that is the appropriate clinical plan, medical plan for that patient and their family, I need to come and be seen. Because I need to be a parent and present in that encounter, not because I was bringing any clinical or medical value. Remember, I took enough math science to graduate, but because it showed the heart of the system. So what you're talking about, yeah, there were some clinical and medical vulnerabilities, but you're also talking about insensitivity. That is an element of diversity, and that's where I think each health system, each hospital system has to take responsibility not only for their medical and clinical actions, but what are they doing to minister and to speak to the heart of that person. I could tell you so much more about Friday. Friday transformed my career. I told Suzanne, I've never experienced anything like that in 22 years.
I think the big comment there that I would take away is with implicit bias, that question of, are you seen? Am I seen? Are you seeing the individual there in as much of their wholeness as possible? I think that's a wonderful, wonderful comment. Do we have any other questions? I think we've got a couple. I'm going to do this side of the room. See, y'all should have sat on the front row.
I'm just going to piggyback on that question. How are each of your specific companies contributing to make sure that the right people are in the rooms?
I'm gonna say USC Upstate. I'm in the room, so so anything we make decision-wise that's affecting students, programs or anything like that, I'm in the space, and our leadership is very diverse as an organization, women, men, as race, ethnicity as a whole. So.
I'll let you answer, Casey.
I think the important thing is to, when you're in the room and you see the absence of voices, that you think about more people who can be included. Now, sometimes you can have too many cooks in the kitchen, and you know what happens. But more people in the conversation brings diversity of thought, which typically results in better solutions. And sometimes you can't hurry up to make a decision. It may take a couple of meetings to get to a decision, but it's a better decision. And I think that's one thing we do really well at our organization, is try to identify who else needs to be included in the conversation.
Do we have time for one more question? Okay. All the way to the back.
Thank you. Anybody from Michelin knows I like to talk a lot, so I apologize for this. Michelin did a training on unconscious bias, and we put the whole organization through it. And one thing I want to comment, and I want your feedback on it, is once you've uncovered an unconscious or implicit bias, it's no longer unconscious. And so please, I love your comments on this because I'll take it all back and I love to feed it into our training. So I appreciate your feedback.
I think Leslie cautioned us, or she asked us to be transparent. I think that once you know what your blind spot is, what your issue is, you need to be aware of that every time you're in the presence of whatever the situation is. And that takes a lot of self-awareness, and it can be painful to acknowledge that this situation, this circumstance, this demographic, whatever the this is, makes you feel some kind of way when you're come in contact with it. So it requires personal work. I know what my issues are, and so I'm always trying, at least I try. The Harvard study told me stuff about myself that I did not believe, and I'm thinking, you're a diversity officer. How you? But now I know, I can't unknow. And so we need to be aware, and that requires constant conversation. And going back to what Vida said, we've got to hold ourselves accountable and surround ourselves with people who do. One quick story. I told you enough math and science to graduate. There's a lady back there who sits on this thing called our safety huddle. And we were hearing comments about the safety huddle one morning, and I have my clinical friends on speed dial because they love to use terms I don't understand. And they were talking about some sort of procedure that had the word fecal in it. I sent homegirl a text. I said, is that, Nedra, is that what I think it is? And she said, yes, and sent me a not so happy emoji back. My point is, you got to have somebody that will keep you legit, will tell you what you don't know. And you don't stop with one training session. That's all the time.
I would say this, your CEO is your chief diversity officer, not the chief diversity officer. Because whatever your CEO says will happen. So you talk about, we go through unconscious bias, I do the trainings all the time. What are you doing to put it in your performance evaluations? What are you doing to look at your policies and procedures as far as that's concerned? Who are you assigning accountability partners at certain levels, whether it's entry, mid-level, or senior level as far as that's concerned, and vice versa? Because one of the things you're probably not doing is putting an entry-level person to be an accountability partner with a senior-level person. Because most organizations are top-down, not up to the top, right? So you have to really think different when you're trying to actually move past it. And once you know those things, I think it was earlier said, look at the one or two things you know you can address right away, and what are the long-term strategies around the other things as far as they're concerned. And that's something you check through performance evaluations, policies and procedures, what people are doing, and what you're doing to move that needle along for that unconscious bias and for people feeling like that. As Leslie said when we first started it, it's the hardest thing for people to do is to own their own bias. But they don't start owning it until you start holding them accountable.
Thank you. I appreciate everybody's attention. I think we've reached time. Can we have one more round of applause for our amazing panel up here?